Welcome to Module 2, which is the recovery program. Now then, if you're watching Module 2, this means you've taken your evaluation, you fill it out, you've got a score, you're either mild, moderate, severe. All right? If you haven't done your evaluation, it's not wise to watch this video because it really wouldn't apply to you and you wouldn't be able to basically use the tools we're going to show you and what you need to do to get clean and sober from whatever your addiction may be: alcohol, drugs, gambling, compulsive spending, hoarding, internet. If you did get your evaluation done, and you got your number, you know if you're mild, moderate, severe, welcome to Module 2. We're going to discuss the recovery program now. The recovery programs, be it to alcohol, drugs, compulsive spending, gambling, are presented in the same format. What we basically present to you is, and should be on your screen now, are therapeutic recommendations and by level of disease. Your disease is broken down into mild, moderate, and severe. Now then, you should have your level of disease based on your score from your evaluation, and the therapeutic recommendations that we give for your recovery program are going to be broad, they're going to be involved, and there's going to be a lot of them. We also have, on the level, be it mild, moderate, or severe, you're going to see check minus or plus plus, and these basically indicate what we want you to do. The recovery programs that we recommend for any individual, be it their addiction to an alcohol and drugs or recovery programs, are broad, they're in-depth, and they're total. In other words, there may be some things in these recommendations that will not apply directly to you. All right? For example, under the alcohol and drug recovery program, we have oral and abuse to be given. Now then, if you're on your third DWI and you're facing prison time, it might be wise for you to have a pharmacist watch you take anti-abuse. It can keep you out of prison. If you're just in a situation where you're having problems at home with your wife due to your drinking, then it may not be necessary to take anti-abuse, or if you're drinking to the point where you can't stop and you need a recovery program encouragement, which is anti-abuse is definitely encouragement, this may apply to you. So what I'm getting at is in the recovery program itself, there are going to be a list that involves a tremendous lot of modalities and a tremendous amount of recovery vehicles for you that may not apply to your strict situation. The point of it is you have to look at each thing that is made available to you, because the items in this recovery programs have been used by myself with a lot of my clients over a period of 20 years, and it's all designed to give them the best shot at recovery. So when I say things like a 1,500-word essay, well, I recommend that to about everybody in recovery, because the first step in a 12-step program is to admit that you're powerless over blank. Now, you may be powerless over pornography, gambling, cocaine. Well, you know, to write a 1,500-word essay demonstrating to yourself why and how you know you're powerless over this particular chemical agent or behavior is very significant. So look through your recovery programs, see what is recommended, and please be honest when you open yourself to entering yourself into the recovery process. The more things you do, the better it's going to be for your recovery. In other words, if you've been trying to do things your way for several years, you're not going to be particularly successful in this, and it may be wise to use other mortality characteristics and modalities that you haven't thought of in the past that other people have thought of and they've used successfully. So look through your recovery program, see what's recommended, see what tailor fits you, but be honest when you look at it. And remember, recovery just doesn't happen. It's a job, and you have to be honest with yourself on what you need to do. So look over your recovery program, figure out what you're going to circle, see what we've recommended, and try to be really rigorous in your recovery program. With that, I'll see you in Module 3.